What do you do if you find someone fainted and lying on the floor? Well, you need to do the ABC of first aid. A stands for airway. You need to ensure that their airway is clear. How do you do that? Well, tilt their head gently towards the back and gently push their chin upwards so that their airway is cleared. Now, if the airway is clear, the next thing you need to do is B, and that is breathing. You need to check that the person is breathing. Look, listen, and feel for breathing. Place your palm gently on their chest and try to feel for their chest moving up and down. And also place your ear near their mouth and nose and try to listen in and see if they're actually breathing. Now, in case this person is not breathing, then you move on to C, which is circulation. Now, what you want to do is gently press their chest up and down and create compressions to support circulation. This should help them start breathing again. Okay, so let me summarize ABC. ABC stands for airway, breathing, and circulation. Now, you do all of these things only if the person is unconscious, and you perform the circulation only if the person is not breathing. Okay, but not in all cases is the person unconscious, right? What if a football player is hurt and has a muscle injury? What do you do then? Right? It's clear that the person is breathing, so we're not worried about that, but we want to help him with his muscular injury. Well, what you need to do here is RICE. Funny, isn't it? But RICE basically stands for rest, ice, compression, and elevation. Let me explain each of these in short. So, rest is where you rest the injured portion of your body. Let's say you've gotten hurt near your knee. What you want to do is rest your knee, right? And avoid any massages because that can worsen your injury. And avoid any painful movements. If a movement is not painful, then you'll most probably be allowed to do that, right? So that was our first step. Our next step is I. That stands for ice. Wrap some ice in a towel and place it on the injured portion. Avoid placing ice directly on the skin. Now, what ice actually does is it cools down this portion to the extent that it numbs the nerves at the site of the injury. And that can help with your healing. Use ice 10 to 20 minutes at a time, depending on how much you can bear. And you can keep doing this every few hours for the first 48 hours to 72 hours or so. Next comes C, compression. Take a small crepe bandage and wrap it around your injured portion. Don't wrap it too tightly. Ensure that there's a little bit of room for movement as well. Our next step is elevate. Elevate the site of the injury above the heart's level. And you can do this for about 24 hours and you'll notice that swelling will subside. Okay, let me summarize RICE for you. Rest, ice, compression, elevation. That's it for this video. Thanks for watching.